Hi, how are you? This is Tiffany, the nurse practitioner with Dr. Wilcox, and today I'm here to talk about gestational surrogacy. We have a lot of patients who ask us questions about third-party cases, part of it gestational surrogacy, and we think that it's a wonderful way to help some patients achieve their family, especially for patients who have problems with their uterus or if they're not able to carry the pregnancy full term. So the process with gestational surrogacy, first of all, the nurse coordinator, along with Dr. Wilcox, can help the intended parents screen for potential candidates. Ideally, we do want candidates who have delivered before and have a track record of proven successful live births and deliveries. And we also prefer the candidates to be less than 40 years old. There's also other requirements, but contact your nurse coordinator. She'll be able to give you a more detailed description of what we're looking for in a good candidate for surrogacy. Once we have the candidate chosen, then we will contact the candidate for a screening appointment. When the gestational surrogacy candidate is here, we will be conducting a consultation where we gather information about the person's health history, pregnancy history, delivery history, any surgeries and medications and little details like that to make sure that she is a healthy candidate. Then we'll be performing a physical examination that includes a mock transfer, which measures the size of the uterus, a water ultrasound or a sonohystogram to make sure that the uterus cavity is nice and healthy with no polyps or scar tissues and can accept an embryo successfully. We'll also do some blood tests, which includes infectious diseases and sexually transmitted infections, as well as a drug screen just to make sure the candidate is healthy. Once we get all the results back, then we can issue medical clearance for the gestational surrogate candidate to proceed to a psychological evaluation and a legal agreement with the intended parents. The psychological evaluation is protection for both parties to make sure that both parties are psychologically okay to proceed with this special arrangement. The legal process also would help both parties achieve a contract that they both agree on through attorneys, just so that the process will be less complicated. Once our clinic gets all the clearances for the medical, the psychological, and the legal, then we will be able to proceed with treatment for the gestational surrogate. So that's kind of the general gist of how gestational surrogacy works. If you have any other questions, you can contact your nurse coordinator for more information.